really thrilled that you joined us today. And if you're joining us in the recording, thank you for setting aside time to watch this. This is a series that we're really excited to be putting forward with and for the community. And so let's go ahead and jump in because I think most of my topics are on the slide. So for those of you who don't know me, my name is Gabi Conacher. I am the ELC chair. And really thrilled to be with you today and working with a fantastic team of community members via our steering committee. And we're really excited to bring you this information today. So in terms of what we'll cover, why federal advocacy is important. And we've got Katie Smith from TSC Alliance, Federal Government Basics with Joanna Gray, who's with Artemis Policy Group, and Laura Widener with the Epilepsy Foundation, and then Appropriations versus Authorizations with Liz Powell and Chris Cooper from G2G Consulting. So we've got this awesome lineup of really smart, experienced people to help walk us through this. So it's going to be a really exciting agenda. Next slide, please. So a couple of housekeeping elements. We are recording this training and it will be shared with everyone in the community as an evergreen resource. We really are hoping that this becomes a resource that people can tap into when they want to learn more about advocacy and what it is and how to do it. And a reminder that this is one in a series. So we will be doing another one next month, which we'll be announcing at the end. As we're going through, I really want to encourage people to drop their questions into the Q&A. We will have time at the end for answering your questions and engaging with you all about this topic. But I think also feel free to use the chat to share, things that come up for you or something that resonates for you or something that gets you thinking. Just use it as a way to engage with the community who are on the call with you today. So I'm going to just do a quick synopsis of why we're doing this training today and a little background on ELC and policy. So first of all, if you have been engaged with ELC over the last year or two, you've noticed that we've been doing a lot of work to try to figure out how ELC can be a more effective convener and partner in the epilepsy space in bringing people together to work on really important issues. And one of the things that really came up when we were doing our work on the landscape analysis, looking at the Institute of Medicine 10-year anniversary, we were, and then a survey we did with the ELC community about what was most important for ELC to work on. What rose to the top was, one of the things that rose to the top was advocacy. So we're really excited to be moving on the requests of the community and bringing you this kind of a training and engaging resource. So our goals today are really to explain the legislative process, talk about what the timelines look like. Everything moves at a very rapid clip within this systems. So it's really important for us to understand the timelines that we have to adhere to as advocates within the government timelines. We want to give some information on the different kinds of committees and leaders in Congress that work in epilepsy or that are important to epilepsy legislation and appropriations. Give some insights into how the system really works. We have an amazing group today who have been deep in this, behind the scenes, doing this work for many, many years and can speak with a lot of authority about how the system works. And then, as I mentioned, this is going to be a series, and what we really hope we can inspire is that more and more people in the epilepsy space become advocates and are speaking out to help us get additional funding and support for the epilepsies. Next slide. Quickly, I'll just share that you may know that in 2018, ELC held a workshop and developed a policy agenda that over the last 5 years has served as guidance for the issues that we support and sign on to. And they were really focused on research in epilepsy, surveillance, data collection and prevention activities, and access to care. We are currently in the process of updating our policy agenda, which is being led by two of our speakers today, Joanna and Laura. So you're in really good hands, and we will be sharing that updated policy agenda for review and approval by the membership in the near future. All right. I think next up is Katie. I think that's the end of my slides, right? Awesome. Thank you so much, everyone. Glad to have you here. And Katie, the floor is yours.
All right. Thank you, Gabby. Hi, everybody. I'm Katie Smith. I am the Director of Government and Global Affairs at the TSC Alliance. And I'm going to talk a bit about why federal advocacy is important. Next slide. So there are many reasons to advocate, including influencing laws and policy and systems that affect communities to make change. Certainly advocating for research funding is something that's very important that can be done within the community. Also, you want to be sure to raise awareness and educate lawmakers about issues that are important to you. It's really important to remember that your elected officials are there to work for you. Advocating is a great way to let them know about what's important to the people in their communities. So you can have an impact on many different things, including policies or things like research funding. Next slide. So some big examples thinking about different ways that policy advocacy can be used to change policy and improve lives of people with the epilepsies. A few examples include the American Disabilities Act, which is one of the most monumental examples of this. In our country, historically, there has been rampant exclusion and discrimination of people with disabilities. People with disabilities and organizations were fed up and banded together to start protesting, testifying, battling in the courts, and pushing for legislation to more clearly prohibit disability discrimination. And to do this, it took years and years of work and advocacy. But because of their tenaciousness, people with disabilities now have guaranteed rights in many aspects of life, including employment and public entities, public transportation, public accommodations, and telecommunications. There are some additional examples here of policy changes, such as laws changing the Affordable Care Act, for example, and that we know prohibited discrimination based on pre-existing condition. And it has helped tens of millions of people gain access to coverage. It's helped stop insurance companies from imposing lifetime or annual limits on essential health benefits, and it has created maximums on how much people have to spend out of pocket for their health care. Another example is Medicare 6 protected classes, which ensures the Part D beneficiaries have all or substantially all access to anti-seizure medications. And every time that this policy has been threatened, certainly advocacy has helped to save it. And lastly, advocacy has helped in federal funding for the VA Epilepsy Centers of Excellence. It's helped through advocacy. The funding for that has gone from $6 million a year to $19 million a year. Next slide, please. So I also wanted to highlight an example of advocating for research funding from the TSC community and the TSC Alliance. So the TSC research program began in 2002, and it was started when the grandfather to twin girls with TSC wanted to know how he could do more to help individuals and families affected by TSC, and also what he could do to help spur TSC research forward. So this grandfather talked to his congressman about the need for this. And as a result of that, the Tuberous Sclerosis Complex Research Program in the Department of Defense's Congressionally Directed Medical Research Program was established. So the Department of Defense has a congressionally directed medical research program that funds high-risk, high-reward research in a number of different areas. There is, in addition to TSC, there is also a program for epilepsy. And so when funding initially began for the TSCRP, there was $1 million appropriated. And most recently, it was funded at $8 million with a cumulative amount of funding for $113 million. Since its inception. And this really is due to the incredible advocacy of the TSC community. We have people come every year to Washington to share their stories about living with TSC and so they can let their legislators know what is important and why continued research for TSC is important. And this particular program is important because it's the largest funding source specifically for TSC research. And one of the key aspects of it is that it involves individuals and families affected by TSC in the grant review process to help assess how any projects that are submitted to them may benefit the TSC community. The TSC Alliance also works in collaboration with the TSCRP and the National Institutes of Health to make sure that we're aligned on prioritizing the priorities for TSC research, and to also make sure that funding isn't duplicated. Next slide, please. And then I wanted to highlight also one example of the clinical impact TSCRP funding has had, and that would be for a recent FDA-approved medication. So in 2009, Dr. Mary Kay Koenig conducted a very small clinical trial using topical rapamycin cream to treat the skin manifestations in TSC and neurofibromatosis 1. The preliminary results in 2010 helped her receive a TSCRP Clinical Research Award to pursue a randomized clinical trial to study the safety and efficacy of topical rapamycin in treating TSC-associated angiofibromas. So in 2022, the FDA approved the first medication for TSC-associated angiofibromas known as HIFTOR, and this long drug odyssey of 13 years would not have happened without the TSCRP funding. And this medication has had a great impact for so many in the TSC community. Next slide. And then I will pause to let you read this quote, but I really wanted to highlight from Colonel Reed Novotny. Looking back over the past 20 years makes me realize that even the most complex medical problems are no match for a concentrated effort by the DoD to create change. And I think that this really highlights the impact that this program has had and advocating has had. In this picture are actually the twin granddaughters of the grandfather that helped the TSCRP funding get started. And I think it really shows that one person's advocacy can make a tremendous difference in the lives of thousands of people. I think Joanna is next.
Thank you so much, Katie. You are a tough act to follow, hearing those kind of personal stories of how advocacy is so important. I'm going to take just a couple minutes and do a little bit of a federal government 101. I don't know about you, but it's been a minute since I was in high school civics class. And before we talk about kind of how to advocate, you kind of need to know who the targets are. So I'm going to take a little bit of time to talk through the three branches of government and then pass the mic to my colleague Laura, who will do a deeper dive on Congress. It occurs to me I should introduce myself before I get further. My name is Joanna Gray. I'm a principal with the Artemis Policy Group. I have been in the epilepsy community since 2007 and serve as the Deputy Director of the National Association of Epilepsy Centers. I also serve as a federal policy advisor to the Child Neurology Foundation. Okay, enough about me. Let's talk about the federal government. So you might remember there are three branches of government. The first on the slide is legislative. We have Congress, the House of Representatives, and Senate. Again, we're going to do a deeper dive on them in just a few minutes. The executive branch starts with the White House, the president and the vice president. And oh man, look at this graphic. We have got to update this, huh? And then all of the federal agencies that come from them. And then the judicial branch starts with the Supreme Court and then goes to lower courts beneath it. Next slide, please. So the executive branch, what are the powers that are specific to the executive branch? The citations here all come from the Constitution. The president, as you all know, is the commander-in-chief of the U.S. military and has appointment authority for executive agencies, members of his or her cabinet, the Supreme Court, et cetera. But the president and then all of the agencies that fall beneath him or her are also responsible for making sure that all laws are faithfully executed. They implement the laws that Congress passes. Next slide has, oh, this looks like this got cut off a little. But you can see at the top, we start with the executive office of the president. You know, obviously we have President Joe Biden and Vice President Kamala Harris right now. If the first arrow goes to the U.S. Department of Health and Human Services, that is the cabinet level department that has lots of public health and public health insurance agencies that are important to people living with the epilepsies. I'll talk about them in just a sec. In the middle, we have the Department of Veterans Affairs, and then the Department of Defense on the end. So when we go from the president to the department levels, the next set, the logos beneath are for individual agencies. So we go from HHS to the National Institutes of Health. The primary home for epilepsy research, though not exclusive home, is called the National Institute of Neurological Disorders and Stroke, NINDS. There are other institutes and centers at the NIH that also do research on related to epilepsy and its many comorbidities, but NINDS is really the headquarters. You can kind of see the top next to NINDS is the FDA, the Food and Drug Administration. The Food and Drug Administration is responsible for making sure that medications and medical devices are safe and effective for use. Obviously, people with epilepsy take medications approved by the FDA, and there's a growing number of folks getting devices implanted, also approved by the FDA. Next, we have the CDC. The Centers for Disease Control and Prevention, of course, has been very much in the news the last couple of years for everything related to COVID, but it has a number of programs really dedicated to epilepsy. There is a program that supports self-management for people with epilepsy, and there are also a couple different surveillance programs that gather information about people with epilepsy throughout the United States. Finally, in this section, we have CMS, the Centers for Medicare and Medicaid Services. We could have had a whole kind of subset of sub-agencies, but CMS is the home, as you might guess from the name, for the Medicare program, the public health insurance program for the elderly and folks who are disabled, the Medicaid program, which provides insurance for people with low income. And it also is responsible for administering many parts of the Affordable Care Act, which Katie mentioned a few minutes ago, which sets rules. They enforce rules for private insurance plans that the ACA put up. Under the VA, we have the VA, oh, sorry, yeah, just two more bullets. The Epilepsy Centers of Excellence. I think Katie mentioned those as well, that there has been increased funding for the Epilepsy Centers of Excellence that care for veterans who may be affected by traumatic brain injuries or seizures from another cause. Katie just talked at length about the CDMRP program, the Congressionally Directed Medical Research Program that is under the Department of Defense. So I won't spend a lot of time there. And just beneath that is the logo for TRICARE, which is the insurance program for members of the military and their families. So that was kind of an alphabet soup of federal agencies. What I think is most important for you to know is just to kind of zoom out and look at the slide. There are tons of federal agencies that that are important for people with epilepsy. And a lot of our advocacy focuses on Congress, but in later webinars, we'll also talk about how can you advocate with the agencies that are implementing programs and implementing laws that matter to us. Next slide, please. The third branch of government is the judiciary. This is a picture of the Supreme Court. Again, the Supreme Court is kind of the head of the judiciary, and then there are lower courts below them. The Supreme Court issues decisions about whether laws passed by Congress or policies implemented by the executive branch are constitutional. It's the whole checks and balances thing. That's the role of the judiciary. Next slide, please. So I'm going to just do the very high level basics of Congress and then pass the mic to Laura to dig deeper. But Congress, we use one word, but we describe two chambers. The Senate which is the upper chamber, and the House of Representatives, which is the lower chamber. Each Congress lasts 2 years. So we are right now in the first session of the 118th Congress. Why that matters is, as you can see on the slide, if the bill is not enacted before the end of a Congress, it has to be reintroduced. But also, as we get to the end of a session, at the end of a calendar year, or at the end of a Congress, that's usually when there's lots of activity as Congress goes to try and pass bills before the new Congress takes over. My last slide is the next one, which has the makeup of the current 118th Congress. This is after the election that was held last November. The Senate has 100 members. They gained 1 Democratic seat, so it's 51-49 in the Senate balance of power, Democrats to Republicans. In the House, the power flipped from Democratic control to Republican. They gained 10 seats and have just under that as a margin between the parties. I'm now happy to pass the mic to Laura, who is going to dig deeper on the House, the Senate, committees, caucuses, everything you need to know. Take it away.
Great, thanks, Joanna. Hi, everyone. I'm Laura Widener. I lead the advocacy team at the Epilepsy Foundation, and then I'm also on the ELC steering committee and help support the ELC's policy work. Just want to give a huge thank you to all of you who are already engaged in advocacy work. We do more together, so I really appreciate your engagement. And for any of you who are new to advocacy, welcome to the table. The more, the merrier. So as Joanna said, I'm going to dig into the 2 chambers within the United States Congress. So we'll start with the U.S. House of Representatives. As the slide says, each state is represented based on their population in the U.S. House of Representatives. Essentially, that all starts with the census. That's what gives us the numbers. And from there, a certain number of seats are apportioned to each state. And then it's up to the state, oftentimes the state legislature, to actually draw the districts. And as we all know, sometimes there are court cases about how those districts are drawn, but there are certain principles and fundamentals that they are to comply with as they draw those districts. Every state has at least 1 representative, and then we've provided the link here. If you don't know who your U.S. representative is, please look them up. Sometimes within your zip code, the district is split. So, but that link will help you identify who your member of Congress is. And again, sometimes when there's redistricting, it can change. So it's good to always look it up and make sure you know who your current representative is. There are 435 voting members of Congress. California, not surprisingly, has the most representatives at 53. There's 7 states where they only have 1 representative. That's of course based on their population. And then of course 6 non-voting delegates are in Congress, so they don't have the power of a vote. And you know, of course, Washington, D.C. is one of those where I live, as well as the U.S. territories. For the House, elections happen every 2 years. So basically, representatives they get their seat and then they're kind of off to the races again. They're kind of constantly in re-election mode, and the representatives in the House have some exclusive powers, like initiating revenue bills and impeaching federal officials. Next slide. So before I start here, I always like to remind people that all members of Congress are important. If you develop a relationship with them and teach them about epilepsy, anyone truly can become an epilepsy champion. All that said, the way that Congress is structured, there are certain members who are in leadership or placed on congressional committees. And they're just good people to be aware of, especially if your representative or senator is in leadership or on a committee, because as bills are talked about in Congress, they're basically sent to a committee. And again, if your representative happens to be on a committee that's considering epilepsy funding or a bill that impacts the epilepsy community, they're in a really good initial position of power to get that funding or that bill moving. So again, all members are important, but it's also good to know if your member is in leadership or on a committee, because they might be in a good position to get issues we care about moving. So here we have indicated who is currently in leadership in the House of Representatives, obviously controlled by the Republican Party right now. I won't go through all the names. You can see them, and we'll share the slides in the recording so we can move on to the next slide. And then I want to go through a few of the key House committees. So again, each chamber is organized into committees, and committees have designated jurisdiction, which means as bills are introduced and considered, if the bill falls within that committee's jurisdiction, they're the ones who receive the bill and can get it moving. So I'll just talk through a few that are really important to the epilepsy community. So first, there's an appropriations committee in the House, just like there is in the Senate. And the appropriations committee essentially drafts and starts advancing the federal budget for the year. So again, they dish out the money. They're very important. All the money that flows to federal government agencies that have an impact on the epilepsy community or provide health coverage for people with epilepsy. The money is decided initially by people on the appropriations committee. The approps committee is often a very coveted spot for members of Congress to be on. Once you get on there, you don't want to get off. So we've listed for each committee actually a link to who the current members are. So again, you can look up to see if your member happens to sit on that committee. And we've also listed the chair, who chairs are from the majority party. So they're, they lead the committee essentially. And then there's a complementary ranking member from the minority party. So they basically kind of co-lead each committee, the chair and the ranking member. Second, there's a committee called Ways and Means. They're important because they have jurisdiction over Medicare and Social Security, both of which are very important to the epilepsy community. And again, we've provided a link to the full committee membership as well as who the chair and ranking are for that committee. Next slide. Next, we have the House Energy and Commerce Committee. They have the broadest jurisdiction in Congress, so they oversee bills and policy related to public health agencies, Medicaid, some private insurance, and a lot of the Affordable Care Act. So again, committee members and chair and ranking are listed there. And finally, I think this is the last House one, the Committee on Education and the Workforce. And they're important because they oversee things like family medical leave, the Americans with Disabilities Act, and again, we provide the committee members and the chair and ranking for ed and workforce. Next slide. Great, so moving to the upper chamber of the United States Senate. So there are 100 senators total, equally distributed, 2 senators per state. The territories and the District of Columbia do not have senators. And again, we've provided a link so you can look up who your current United States senators are. Elections in the Senate, once you're elected to the Senate, you serve a term of 6 years. And to make sure that the full Senate isn't constantly flipping every 6 years, they've divided the Senate into 3 classes. So basically every election cycle, about a third of the Senate is up for re-election. And you can easily Google and find out if your state senators are up for re-election anytime soon. The Senate has some exclusive powers as well, like confirming political appointees, judges, and ambassadors. And then the big thing procedurally in the Senate, which is really important to know, is that for most bills to advance, you've probably heard of something called the filibuster. And to get past the filibuster, the ability to debate in the Senate, it does require a 2/3 or, over 60 vote threshold it's called invoke cloture, and basically end debate on that bill or that thing. So that 2/3 vote threshold is really important because you have to get past that first to end debate, invoke cloture, and actually proceed to voting on the bill. Once you get to voting on the bill, it only requires a simple majority in the Senate. But because of that two-step process, that 60 vote threshold is very, very important. And sometimes why things, tend to move a little slower in the Senate because you have to meet that threshold first. Next slide. Current leaders of the Senate, again, not going to go through names, but you can look through and see if your senators are in leadership. Then we have the Senate committees on the next slide. So like I said, there's also an appropriations committee in the Senate, similarly charged with drafting the funding bills for the federal government. The Senate Committee on Finance is important because they have jurisdiction over Medicare, Medicaid, and Social Security. Again, committee members and chairs and rankings are listed here. I'm already at time, so I'm speeding up a little bit. And lastly, we wanted to highlight the Senate Health, Education, Labor, and Pensions Committee, otherwise known as the HELP Committee. They have jurisdiction over public health agencies at the Department of Health and Human Services, private health insurance plans, and laws against employment-based discrimination. And again, the committee members link is there, and the chair and ranking Senators Sanders and Cassidy, which is a very interesting pairing. I think the last thing I'm going to touch on before turning it over are caucuses. So there are committees in Congress. We talked about those. There are also caucuses. Caucuses are a group of members committed to a certain cause and to pursuing policy solutions to help that cause. There are literally hundreds of caucuses in Congress. There have been some related ones around for a while, like the Rare Disease Caucus, the Disabilities Caucus, and the Neuroscience Caucus. But hopefully you're already aware that very excited in late February of this year, Representatives Greg Murphy of North Carolina and Jim Costa of California established the first ever Congressional Epilepsy Caucus. We're building up membership. We have 16 members so far. Caucuses tend to originate in the House, which is why we started there. We hope to launch a complementary caucus in the Senate at some point. But now that the caucus is launched, it's something available for the whole community. It's a way to build champions for people with the epilepsies. It's a way to organize if there are bills or funding that we support or don't support. We could go to the caucus and try to enlist their support or opposition. And I think on the next slide, we provide a list of those 16 members. So if your representative is already on, it would be great to reach out to thank them. And even more importantly, if your representative is not on, please reach out and urge them to join. We'd really like to get the numbers of the caucus up. And at the bottom there, if you do reach out to your representative's office, they simply have to contact one of the co-chairs in order to be added. So we've provided the co-chair staffers' email addresses at the bottom of that slide. And I think with that, I'm turning it over. Thank you so much.
Great. Thank you so much. My name is Liz Powell, and I am going to tag team with my colleague, Chris Cooper. I'm going to cover authorizations. So my quick background is I'm with G2G Consulting, and we were hired by the Epilepsies Action Network to pursue funding for epilepsies overall. And I was a legislative director on the Hill years ago, and then started G2G 16 years ago. And we do a lot in the health space. We've raised $524 million in government funding for a lot of different health issues, as well as some others. And so that's sort of our background. There's really two legislative angles or avenues to pursue funding. That's authorizations and appropriations. So for authorizing, the main goal is to authorize programs for a specific amount of time. While this is important, it's not critical. For example, the State Department hasn't been reauthorized since 2003. So things still move forward through appropriations, even if they're not authorized. It also can take decades. Universal health care started back in 1933 with FDR, and it took until Barack Obama in 2010 to actually become law. So most authorizations should not take that long, but just to give you a spectrum, another example, the user fee reauthorization bills, there's one for medical devices, and then there's one for prescription drugs. Those happen like clockwork every 5 years. That's how it's actually supposed to work, but it can be a range. For each authorization bill, there's some things that really should happen. So the first is to have bipartisan co-sponsorship. This is really important. When I worked on the Hill, I never wrote a bill or even an amendment without having both sides coming together. I think that's really, really important. It really helps the chair of the committee because it's easier for him or her to get it through his or her committee and to the floor. It also enables a process that's called suspension calendar in the House or unanimous consent in the Senate. That also is a faster way to get it to the floor. And finally, bipartisanship is helpful because it also can get wrapped into the year-end omnibus that inevitably happens. So really important to have bipartisanship. A CBO score, congressional budget score, is frustrating because it never takes into account dynamic scoring or the fact that prevention and intervention actually saves a ton of money. So a lot of times we're actually working on this with another client. We're doing our own independent economic analysis to explain and sort of justify why spending is needed. And then in the long run, it actually saves money. So that is a tricky thing that we all have to sort of get through when we're trying to move a bill, but it's really up to the chair to order that score and doesn't really happen until markup is about to happen. The next one is hearings. So they do hearings. Sometimes they'll do a hearing just on one bill, and sometimes they'll do it on multiple bills, like they did last Wednesday in the Energy and Commerce Health Subcommittee. They actually discussed Parkinson's, maternal health, cancer, and some other issues all together at a hearing with about 5 different witnesses. And then what they're doing is they now can move forward on marking up legislation. So the next one, markup. Markup is just another word for amending or moving legislation through the committee. And again, they can do this on its own or in a lump sum with other bills, especially non-controversial bipartisan bills. It is much easier to sort of do this ensemble movement together through the committee. The next item is stakeholder support and advocacy. I cannot stress this enough. Again, if I was visited by multiple groups all telling me they wanted the same bill, that made it a huge priority in my office for me and my boss. So I think that's super important. And it helps build co-sponsorship. Most co-sponsors, whether it's 2 or 4, 2 Ds, 2 Rs, they want to have many more. And if you have hundreds of co-sponsors, your bill is much more likely to pass. You don't necessarily have to have hundreds, but if you get up to 100, you are doing very well. And stakeholder groups are key to that. And members of Congress rely on advocacy groups and stakeholder organizations. So we all can be really, really important in that effort. And a good example is last fall when we did that letter to the president, we had over 225 signatures, all united, saying how important epilepsy is and that the president needs to increase investment. That is a great example of that unified stakeholder influence. So everyone coming together behind a bill is going to be huge for Congress. And then the last item is media coverage, which I think everyone knows members of Congress like to get media coverage. It makes them look good at home to their constituents. So whether we get stories placed in the local paper, could be a patient sharing their story, or a larger like national coverage in New York Times, Washington Post, Wall Street Journal, anything of that sort really helps. The members love to get that kind of coverage. Or even if the member's not in the story, but the story is talking about epilepsies and some of the main problems that we're facing that justifies our legislative request, that really helps a lot. So that is my quick slide, and would love to pass it to my colleague, Chris.
Thanks, Liz. Hi, everyone. My name is Chris Cooper, and I am a government affairs manager at G2G Consulting. I work with Liz and joined the team back in February after spending the past decade plus working for two members of Congress, both of whom served on the House Appropriations Committee. I held many roles in the offices, including serving for years as legislative director, chief of staff, and chief appropriations counsel. So I will spend the next few minutes talking about appropriations, what that means, and how the process typically plays out in Congress. So the Constitution says no money shall be drawn from the Treasury, but in consequence of appropriations made by law. This means that the power of the purse, as we often call it, must be exercised through the lawmaking process or through Congress. And what do I mean by appropriation? So an appropriation basically means a statutory provision that provides budget authority. In other words, authority for a federal agency to enter into financial agreements that will obligate the Treasury to make certain payments. And as mentioned earlier in the presentation, within the committee structure established by Congress, the task of developing appropriations legislation is delegated to the creatively named appropriations committees in the House and Senate. The committees are organized into 12 subcommittees, each of which is charged with drafting and managing the consideration of one regular appropriations act each fiscal year. And each subcommittee has its own jurisdiction over certain federal agencies and programs. Appropriations bills provide funding in definite dollar amounts for specific purposes over limited periods of time. That's sort of the best way to think of an appropriations bill. These are not blank checks for the executive branch to spend as they see fit. Through these spending bills, Congress is asserting its authority, again, under the Constitution, to determine federal spending priorities. For example, the annual, what's called the Labor, Health and Human Services and Education Appropriations Bill, which provides funding for many agencies under the U.S. Department of Health and Human Services, may provide, for example, $48 billion for the National Institutes of Health for that fiscal year. So again, a very specific dollar amount for certain purposes to a certain agency within the fiscal year. And individual senators and members of Congress typically can submit three types of requests to the Appropriations Committee. The first is what's known as programmatic or funding requests. So those requests are when members are seeking a certain amount of funding for a federal program. The second example is what are known as language requests. Those are sort of where members or senators are looking to add language to the bill or committee report to require or encourage an agency to take certain actions. And then the Appropriations Committee, uses the committee report that accompanies the bill to provide more detailed information about congressional intent concerning how agencies should use those appropriated funds. And then the third example is what's known in the House as community project funding and in the Senate as congressionally directed spending. Those requests previously were known as earmarks, if you've ever heard that term. And basically through those requests, members and senators direct funding to a specific state, local government, or nonprofit entity. So during the initial stage of the appropriations process, the 12 subcommittees will review and scrutinize the president's budget request and hold hearings with agency officials on that budget request. They'll request input from other members and senators. There's a formal submission process for each office to submit requests through an online electronic submission system. And then the committees will draft and mark up the appropriations bills and move the bill through the committee into either the House or Senate chamber floor. After the bills are considered in the committee, again, they head to the House or Senate floor for further consideration by the body at large. Over the past several Congresses, the House has frequently considered multiple appropriations measures at the same time, and those are often referred to as minibus measures, if you've ever heard that term. By doing so, chamber leadership, hopes to corral enough votes basically to pass the package, which might be difficult to accomplish otherwise. And then the final stage of the process here is resolving the differences between the package passed by the House and the Senate, for Congress to present any legislation to the president for signature or veto. The Constitution requires that Congress pass the same measure without any differences in the legislative text. So that is my presentation on appropriations. I'm happy to answer. I think we're turning to questions now, and thanks again for joining.
Thank you so much, Liz and Chris, for taking that last leg. And to all our presenters, that was really enlightening. I feel like I've been in this space for, a decade, and I still have so much to learn. So thank you for sharing your expertise with us. So I think we'll jump in with questions. I'll invite people to please drop them into the Q&A, and we'll get to all of those, hopefully. But to start with, and I think this is a great question, and we can probably stop sharing so we can see the folks who are going to answer for us. Thanks. How can a parent of a child with epilepsy get plugged in best on a local level for advocating? And I think, there's people who have diagnoses or don't have, a more generic epilepsy diagnosis versus a diagnosis of something like, tuberous sclerosis complex. So does somebody want to jump in and share some thoughts, or multiple people getting into the practical? What do we do?
Yeah, I can start. Great question. So if you're just getting started, obviously step one, look up who your members are. Every member will have staff, and there's typically one or more staff members who manage the healthcare portfolio for the member of Congress. So that's who you should try to get connected to. It's as simple as calling the office, and asking who that is, or if you're tied into an organization, some orgs have, systems where we can look up who the staff is for that particular member. But you can start by just, reaching out to the health staffer and asking for time. One of our primary things when we train advocates is that while it can seem intimidating, these meetings are truly just conversations. And what's most important is that you share your story. That's what it's all about, raising awareness about the epilepsies and how whatever form of epilepsy or seizures that have impacted you or your family, how it's impacted your life and what's important to you. Obviously, at some point, tying that story to a legislative ask, like a certain bill or a certain funding stream is important, because ultimately the staffer and the member of Congress will want to know, well, what do you want me to do? And you have to have an answer for that. But again, just start by trying to know who the staffer is, connecting with them, starting to share your story, and then I'll pause if others have tips too.
I would also just add, once you have identified your members, I would sign up for their newsletters or to follow them on social media. It's a good way to see what your senators or your representatives care about. What are they posting about in healthcare? They also will post, especially in the summer when they're home or right before an election, they will post local events that they're doing where you can go and meet them. And, you don't need to necessarily have a super polished policy proposal, but you can meet them and introduce yourself and tell them a little bit about your story. So I think that's another kind of easy way to get started.
Yeah, and I think it's so important to hone in on that, the power of your story, right? I mean, that's a huge part of advocacy, is sharing your experience, how accessing care and the kinds of things that you butt up against as a caregiver or as a person living with epilepsy, that if they don't hear about that, they don't know. And then, but if they do know, and then more and more people keep sharing, it has this effect of saying, oh, wow, okay, epilepsy is on my radar now. I hadn't really heard much about it before. And so I think that that effect of kind of building on each other's stories, and all of our stories are going to be different, and share different highlights of what comes up for each of us. So I think that's really, if anything, that's good, great, sharing your story, which, some of us that's easier, some of it might be a little bit harder, but yeah. And thanks, Anne dropped in to find either your members of the House of Representatives or senators. So feel free to click on those links and see if you can find who your members are. And if you want to share them in the chat, let us know. And maybe we can even chime in and say, oh, that person, we can give you little hints, little pointers, because we've got a lot of experts here on the call with us. We had one question about why are committees on the House and Senate side not identical? Why are there so many different, why are they not parallel? Who knows?
I don't know. Does anybody know?
It's a curious,
they kind of are, but I don't know why the jurisdiction of, say, Energy and Commerce, if there's not a House and Senate Energy and Commerce Committee.
Yeah.
You stumped us.
Well,
Anybody else?
yeah, interestingly, there's a few reasons why things don't make sense. One of which, John Dingell, the former chair of Energy and Commerce, loves health issues. And Energy and Commerce was not supposed to have this much health jurisdiction, but he just kept snatching every bill that was introduced. And so now they have more jurisdiction than like the House Ways and Means Energy or a Health Subcommittee. And whereas in the Senate, it's the Senate Finance Committee that gets all the health bills. So it's just sort of happened by certain people. And like another example, why the heck is breast cancer get so much funding out of the defense bill? Well, because a bunch of breast cancer advocates came and lobbied, and John Murtha at the time was chair, and he said, well, if you're not getting enough money out of NIH, we'll just put it in the defense bill. So a lot of times it's because of these very creative advocates, which should motivate all of us. Other times because a certain member of Congress just had an interest in it. And at this point, I think it's such a mess, they can't straighten it back out again. So.
Yeah, well, I think what's interesting too is that, I've been having lots of meetings with members and their staff on the Hill, with Liz and some of these other advocates. And, we ask people in a lot of these meetings, do you have any connection with epilepsy? And almost everybody does. So I think that's something, knowing that 1 in 26 people are going to be personally impacted by epilepsy in their lifetime, there's a way to connect right there, right away, and I think that that's a really powerful thing to keep in mind. We had a great question. If parents or families or patients or advocates want to discuss an issue with their members of Congress that doesn't already have a bill in place that's related to that, what do they do? Where should they start? Do they have to have an ask that's tied to a bill or some legislative agenda?
I'd say, yeah, I mean, I'd start, just by talking through with them the problem or the challenges that you're experiencing. There might, even if you're not aware, there might be bills already introduced that tackle some or all of the challenges. But all that said, if there aren't, it's just starting more from scratch, but that's totally fine. Bills always start at the concept phase, right? So, you just talk through the challenges that you're experiencing or the community is experiencing, and then, the staff in the office and some staff called legislative council usually I'll start to think about, therefore what existing statutes, would need to be amended and how would they need to be amended. Then it proceeds to drafting up text for like what the bill would look like. So you're just starting more from scratch, but that's certainly okay. You would definitely need, your member of Congress or another member of Congress would need to agree to sponsor the bill. You have to have at least one bill sponsor to get a specific new bill introduced. So that would be another thing you'd have to work through. But and we can dig into that more, I think, on future trainings too. It's a good question, and there's a lot there, but those are some basic initial things.
Mm-hmm. Yeah.
I guess I would just, sorry, Gabi,
No, go ahead.
if I could just add on to that. I mean, I do think, unfortunately, problems facing one family in this community are probably facing others. So I think another step is to try and connect with one of the epilepsy organizations that makes the most sense for you and your family. Many of them have advocacy programs, could help you figure out what a policy solution might be to a problem that you're facing. Or sometimes there are more practical solutions. Waiting for Congress to do something is basically the slowest route to accomplish anything. So we try to all really be creative about ways to solve problems. And if there's something that you're struggling with, you should also reach out to any of us on today's webinar. Any of the epilepsy organizations would be happy to chat.
Great. We had somebody ask, all these other groups like Alzheimer's and Parkinson's that have been able to mobilize and really see a lot of progress in funding. There's a question about, what's happening with the epilepsies and how can we increase funding to support the epilepsies?
Well, we're working on it. I mean, again, I don't want to dismiss all the work that has been done. Joanna went through a lot of the federal agencies, and if you totaled up the numbers, that those agencies get specifically for epilepsy, I think many of you would be surprised by the number. It is a lot. Is it enough? Certainly not. And considering the population size of the epilepsy community, it's certainly not enough. So there's definitely more work to be done. I mean, every year for existing programs, we seek increases. And then there are efforts as well to get new funding for new programs to fill gaps. But a lot of it honestly comes back to that awareness and getting members to prioritize, right? So again, the more people, advocates we have talking to Congress about epilepsy and why more attention is needed, the easier that lift will